Most women with endometriosis go undiagnosed for almost a decade and their pain gets dismissed again and again. If you're battling pelvic pain every month and still don't have answers, you're in the right place. Hi, I'm Dr. Jeffrey Brown, and I'm a functional medicine physician with over 15 years of experience helping women balance their hormones and regain their life. If you're one of the millions of women struggling with endometriosis, adenomyosis, or maybe you don't have a diagnosis yet, but you suffer from a severe monthly pelvic, abdominal, and or back pain, I have an important message for you today. In this video, I'll reveal the hidden connection between hormone dysregulation and gut bacteria disruption, and how my unique Endo Relief program can help you finally become pain-free and energized. Are you a woman in her 30s or 40s suffering from chronic pelvic pain, painful periods, or fatigue that doctors can't explain? Do you have discomfort during or after sex? So bad that the thought of being intimate causes anxiety? Are you having difficulty conceiving and have given up hope of becoming pregnant? Do you feel nauseous or bloated often? Is your pain interfering with your ability to work? Is pain ruining intimacy and hurting your relationships? If you can identify with any of these scenarios, you probably suffer from endometriosis or adenomyosis. Without restoring balance naturally, hormones remain dysregulated, so you continue to experience painful, heavy periods, mood swings, and fatigue, which worsens with age and stress. Endometriosis left unchecked can lead to increasing scar tissue, inflammation, and a hormonal imbalance, all of which can lower fertility potential over time. Also, studies show that women with endometriosis have a higher risk of ovarian cancer, so it is very important to restore your body's innate hormone function. I know it must be exhausting to feel like your body's working against you, having to cancel plans, suffer in silence, and feel like doctors aren't listening to you. If you are tired of battling with your body every month and want to uncover the root cause of your symptoms, keep watching this video. If you've been struggling with endometriosis or painful periods, you've likely tried some of the common approaches such as birth control, pain medications, and maybe even have had surgery. While these methods may provide temporary relief, they often fail to address the root cause of your symptoms. In fact, research suggests that between 10 to 50% of women with endometriosis do not find relief from their pain symptoms with hormonal birth control. 1/3 of women who use birth control experience unwanted side effects such as mood changes, headaches, weight gain, and sexual side effects. Pain medications and anti-inflammatories give temporary relief. Pain medications and anti-inflammatories are temporary fixes, and they do not stop the monthly recurrence or other symptoms associated with endometriosis. And chronic use can lead to kidney and liver damage as well as stomach ulcers. According to the American College of Obstetricians and Gynecologists, the percentage of women who report pain returning after having endometrial surgery has some estimated ranges of up to 50% or more, depending upon the type of surgery, within 2 to 5 years of having a surgery. These approaches focus on masking the symptoms and rather than addressing the underlying imbalances in your body. Endometriosis is when tissue similar to the inner lining of your uterus, which is called the endometrium, grows outside the uterus and other parts of the body. The female reproductive organs, abdominal wall, abdominal organs, chest, lungs, and other parts of the brain are locations for the endometrial tissue. That tissue growth causes inflammation, scar tissue, dysfunction, and severe pain. Adenomyosis is when the endometrium grows into the muscular wall of the uterus, causing it to thicken and enlarge, which often causes heavy, painful periods, severe cramps, and painful sex. The reason you're struggling with endometriosis or adenomyosis is not what you might think. The root cause of your symptoms is actually found in your gut. Think of your gut as a command center for your hormones. The control room is the estrobolome, which is a collection of genes and enzymes in the gut bacteria that plays a pivotal role in regulating estrogen metabolism. It determines when estrogen is excreted and when it is reabsorbed. At least 70% of our immune cells are in the gut. Inflammation occurs when our immune system is triggered by an injury, infection, or irritation. The endometrial-like tissue that grows outside the uterus is an irritation that triggers an immune response, creating chronic inflammation. This growth is created by excess estrogen in your system. When the estrobolome performs its job correctly, there's an appropriate level of estrogen excreted and an appropriate amount in circulation. There is no estrogen dominance nor extra endometrial tissue growth. That's why addressing the gut bacteria environment is so crucial for achieving lasting relief. By targeting the root cause, we can help your body work properly and break free from the cycle of pain. So if your gut is the real culprit behind your endometriosis, what's the solution? Because my Endo Relief program is a comprehensive, holistic approach designed to target the root cause of your symptoms and restore balance to your body. Unlike conventional treatments that merely mask your symptoms, my Endo Relief program focuses on identifying and addressing the underlying imbalances that are causing you monthly nightmares. By targeting the root cause, this powerful protocol helps your body to function optimally, allowing you to experience lasting relief and optimal health. In just a moment, I'll go deeper into how the Endo Relief program works and why it is effective in resolving endometriosis. But first, I want you to know that this isn't just some untested theory or passing fad. The Endo Relief program has been shown to work over the past 15 years on women just like you who have struggled with endometriosis and other hormonal imbalance disorders without finding a lasting solution. I started my career over 20 years ago as an osteopathic family physician. Very quickly, I became frustrated and dissatisfied with conventional medicine as I felt I wasn't making an impact on the health of my patients. Writing prescriptions just to mask the symptoms was not why I went into medicine. Determined to find a better way, I became board certified in functional and regenerative medicine. As I implemented my newfound approach to medicine, I was able to help women with health struggles that were unique to them. I became aware that the women's health care in this country was terrible, and I wanted to change that. A friend of mine suffered for years with endometriosis, constant pain, fatigue, gut issues that no doctor could solve. She had been suffering in silence and I had no idea. When she finally asked me if I could help her, I said, of course, yes, and I used my Endo Relief method. Within a few months, she was off all medications, pain-free, and confident again. After seeing her transformation, I knew I had to shift my focus and help more women like her, because too many women suffer unnecessarily every month. Over the past 15 years, I've seen countless women experience less pain, more energy, and renewed hope. My mission is to empower as many women as possible with the knowledge and tools they need to overcome endometriosis, adenomyosis, and other hormonal imbalance disorders. I am passionate about sharing my expertise and supporting patients every step of the way on their path to breaking the cycle of pain, restoring fertility, and living vibrant lives. My Endo Relief program consists of 3 pillars. Pillar 1 is the discovery stage. This step is designed to identify your imbalances. We will look at your hormones during the appropriate time in your menstrual cycle. We'll look at the state of your gut health so you can finally see what's keeping your hormones out of balance. We'll also identify foods and other components that are adding to the inflammation in your body. This step is a flashlight to illuminate the root cause of your pain. Pillar 2 is the balance and optimize stage. Here we address the imbalances that were discovered. This will allow you to finally feel some sense of normalcy that has escaped you for years. You should expect to feel more energized, less pain, improved gut health, and a better overall sense of well-being. In Pillar 3, that's the maintenance stage. Finally, we implement nutrition, exercise, and other lifestyle habits that will ensure your pain relief, energy, and vitality last long-term and not just for a few weeks or months. Now let's recap what I've covered so far. I've shared with you the 3 pillars of my Endo Relief program: the discovery stage, the balance and optimize stage, and the maintenance stage. While the Endo Relief program has helped countless women, I understand that everyone's situation is unique and there's only so much I can cover in this one video. That's why I believe in providing personalized care that's tailored to your specific needs and goals. To help you determine if the Endo Relief program is right for you, I invite you to schedule a consultation with me for a discounted price of $250. During this call, we'll discuss your individual concerns, answer any questions you may have, and create a customized plan to help you break free from pain, restore fertility, and live a vibrant life. To claim your spot, simply click the button below and choose a time that works best for you. Remember, having painful period is not something you have to accept as a part of life. Just because it is common doesn't mean that it is normal. Staying on the conventional path continues a lifetime of symptom management instead of true healing. A cycle of temporary relief, recurring pain, emotional depletion, and declining fertility. So here are some quotes from my current patients. I can hardly express how transformative my experience with Dr. Brown has been regarding my health and well-being. My energy levels have surged, my mood has stabilized, and I feel more like myself than I have in years. That was from Crystal Jones. Jessica said, thanks to Dr. Jeff, my cycle no longer feels like a 3-week ordeal, but rather a manageable aspect of my life. His care has allowed me to reclaim my well-being and enjoy a quality of life I never thought possible. So every month you wait is another month stuck in the same cycle. Let's find answers now. Imagine waking up each day feeling energized, happy, and pain-free. That's the transformation that's possible with the Endo Relief Program. Don't let this opportunity pass you by. So click the button below to schedule your consultation now and take control of your health today.